Denise and John Detrick tied the knot 39 years ago. They had a picture introduction before they first met.
A mutual friend felt that we would be perfect together.
He took individual photos of each of us. And then when he developed a film, he then showed us photos saying, I think you should know each other. I think you'd be good together.
We dated for 2 years, and then John thought it would be wonderful to get married on the 2nd year anniversary of our first date.
Throughout the years, Denise and John's hearts were full of love, a love that kept them strong when their hearts began to beat out of rhythm.
I was first diagnosed with an abnormal heart condition in 2018.
She was diagnosed with atrial fibrillation, which is an irregular heart rhythm. It originates in the top chambers of the heart, where instead of the heart beating in a natural sequence, it quivers, and sometimes it's rapid, but it's always irregular, and it makes the heart function in a suboptimal way, so it does not pump blood effectively to the body.
I would get very, very fatigued. I would have to sit down just to rest. I had shortness of breath. The fast heartbeat caused just chest discomfort and dizziness, lightheadedness.
So she has tried various medications. They're called antiarrhythmic medicines. Those are medicines that we use to try to control the rhythm and keep the person in normal rhythm.
Unfortunately, I did not have very good luck with any of those. And it turned out that the symptoms from the medication was every bit as bad, if not worse, than the symptoms I was experiencing naturally.
John knew exactly what his wife was going through. 6 years prior to his wife's diagnosis, he received the same news. John had atrial fibrillation.
I was highly symptomatic. I had very, very high heart rates. And I guess I'm more in tune with my body. I feel what's going on with my body. So I was very symptomatic. And over a period of time, it just gradually got more frequent and more pronounced.
John tried medications too, but he wasn't able to tolerate them either. Doctors suggested a procedure called hybrid convergent ablation.
So the way it is done is that a patient would get a small incision right below the breastbone, and through a scope, rather than an open heart surgery, through a small scope, they can insert the catheter and place it beneath the heart, and under direct visualization are able to heat the specific areas of the heart tissue that's carrying the atrial fibrillation.
The condition that I was in prior to this surgery, how symptomatic and unable to live my life as compared to how I live it now, remarkable change. I just got off the treadmill. I just did 3 miles an hour ago, so life is good.
Doctors recommended the same procedure for Denise. Ironically, 6 years later, to the day, Denise had the same surgery as her husband.
We saw the surgeon the very same week, Thanksgiving, and then there we are 6 years apart on the operating table to the day. And it was just very interesting to me how things work out in life sometimes.
I thought it was pretty incredible since we do a lot of things together. I didn't realize that would be one of them.
So she had the ablation, and the second day, she spontaneously converted back to a normal rhythm, which was very promising sign. And she's been in a normal rhythm ever since.
2 hearts beating to the same rhythm. And now Denise and John are feeling so much better.
I feel wonderful. I really have lots of energy now, and I'm just enjoying things without being tied down and bothered when I do things that I really love to do.
It changed my life. When I had this procedure done, it literally changed my life.
This procedure is really a game changer for patients diagnosed with atrial fibrillation. As you can see, Denise and John have their lives back.
Thank you so much, Deborah. Joining me is Dr. Safa Gassis, Medical Director of Atrial Fibrillation Center at Penn State Health, Holy Spirit, and Hampton Medical Centers. And, as we saw, Denise and John's doctor. What a great couple. They're both doing really well right now, but they both had AFib. How common is AFib?
AFib is the most common heart rhythm abnormality. About 6 to 8 million people in America have it, and the incidence is actually increasing quite a bit.
So what do we need to look out for? Let's talk about the signs and the symptoms.
And for some people it could be subtle, but the most common symptom is just tiredness and fatigue. People can abruptly feel shorter breath, just kind of running out of gas more easily. For some people, they may feel palpitations or an irregular heartbeat. For others, it could be shortness of breath or swelling in their legs. And for some people, the first sign could be a stroke as well.
Oh my. Okay, so let's talk about treatment then. What are some of the options?
So fortunately, the treatments have advanced quite a bit over the last few years. Traditionally, there have been medications, but we know medicines are quite limited. And some people can have a cardioversion, which means we use an electrical current to reset the heart rhythm back to normal. That's the easy part, but the trick is keeping it there. And about half of people with AFib have the persistent type of atrial fibrillation, which is more stubborn. And that's when we have to use more sophisticated and advanced techniques such as ablation.